This video was made to empower veterans with acupressure self-care strategies that may help with sleep. You can follow along with the tutorial as we demonstrate the technique for 6 acupressure points.
You may perform this self-care routine in addition to your regular medical care. It is not intended to replace standard medical treatments for this condition. This acupressure routine may not be appropriate for some veterans, including those who have brand new symptoms or who are pregnant. It is best to sit or lie down while applying acupressure. If you experience any discomfort, dizziness, or other unusual symptoms, stop the acupressure immediately. If these symptoms do not go away, contact your medical provider. Do not use acupressure over areas where you have a wound, severe swelling or lump, active infection, recent blood clots, rash, or areas that are very numb. However, you may be able to use other points away from these areas. If you take medications to thin your blood or have a bleeding or clotting disorder, only use light pressure.
Acupressure is thousands of years old and likely predates acupuncture. It is natural to want to wind down before bed. Simple things that you can do to enhance a good night's rest include limiting screen time from televisions, computers, and phones in the hours before going to bed, as well as sleeping in a dark, quiet room at a comfortable temperature. This video will teach you an acupressure routine that you can also use to help you relax before bed. VA providers have a great deal to offer veterans to enhance their sleep. Talk to your healthcare provider at your next visit about options available to help you sleep better. I invite you to follow along on yourself as we demonstrate each point. To perform the acupressure routine, you will press or massage the points that you will be taught in this video, usually for 30 seconds each. Use the amount of pressure that feels comfortable to you. Enough pressure to feel some sensation. If painful, use less pressure. Sometimes a light touch is all that is needed.
The first point we will use is called KD1. This point is found on the bottom of the foot in the center of the ball in the groove just before the arch. Hold the foot with both hands and apply pressure with your 2 thumbs, one on top of the other. If you have trouble reaching this point with your hands, you may be able to apply pressure to the point with a firm ball, like a tennis ball. Do this by rolling the foot over a ball on the floor, like this. If it is not easy to reach this point on yourself, skip it and move on to the next point in the routine. Press and hold or massage this point for 30 seconds. Many of these points can be done on both sides. In the video, we are only going to show you how to do the point on one side. If you would like to do acupressure on the same point on your other side, feel free to pause the video and resume the video when done. The next acupressure point is called SP6 and is found on the inside of your ankle. There are multiple ways to reach this point. You can cross your ankle over your opposite knee if you are sitting in a chair. If this is uncomfortable for you to do, bend forward at the waist to reach down toward your ankle or bring the foot close to you by propping it up on a chair in front of you. If these options don't work, try asking a caregiver to massage or press this point for you. To find this point, start at the bone that sticks out on the inside of the ankle. Place the edge of your hand on the high point of the inner ankle bone. Use your hand to measure from the ankle bone up your leg. Where your hand ends is where SP6 is located. Be sure you are in the softer area of the leg, behind the shin bone. Press and hold or massage this point for 30 seconds, or try pressing and releasing for 30 seconds. Use the technique that feels best to you. Feel free to pause this video to switch to the other side and press for 30 seconds. The next point is called PC6. Let's find the point in the middle of the inner wrist, about 1.5 inches from the wrist crease. You can use 3 fingers to measure the distance from your wrist crease to where the point is located. The point is in the center of the wrist where you feel a tendon band. You can use a finger pad like this to press the point, or your thumb like this. Start out by applying a light pressure and slowly deepen using a pressure that is comfortable. Don't push so hard you cause pain. There are nerves and blood vessels running through this area. If you feel a numbness or tingling running into your hand, use a little less pressure. Gently press and hold for 30 seconds, or try pressing and releasing many times for 30 seconds. Other ways to press the point are to use a knuckle like this, or a pencil eraser like this. Do what feels best to you. The next point to help with sleep by calming the mind is called HT7. This point is found on the palm side of the hand at the wrist crease straight down from the pinky finger. You will feel for a bone at the edge of the wrist crease that feels like a small rounded mountaintop. From the high point of the bone, slowly slide inwards towards the wrist crease until you are in a small valley or dip just below the bone. Press and hold this spot for 30 seconds. You can also rub in small circles. You can use your thumb or index finger or use a pencil eraser. You may feel a pulse under your finger at this spot. It is close to an artery. This is a normal sensation and only use the amount of pressure that feels best to you. You can pause the video if you would like to do this on the other side, and resume playing the video when done. The next acupressure point is called An Mien, which means peaceful sleep. This point is found on each side of the head, behind the ears, and about level with the earlobe. To locate An Mien, place 1 or 2 fingers behind your ear, feeling for the bottom of the skull bone. Move your fingers back until you are about 1 inch behind the earlobe. Try staying just underneath the skull. You can use your fingertips to locate a small dip in this area. Press into the groove with the amount of pressure that feels right to you. Press and hold the point, or try rubbing using small circles for 30 seconds. You can also press and release repeatedly for 30 seconds. Use the pressure that feels best. You are welcome to try finding and pressing both sides at the same time. Or if it's difficult to reach using both hands at the same time, just press on one side at a time, then switch to the other side. You can also ask a caregiver to assist with massaging this point for you. You can also try lying down face up and support your arms with pillows while you press this point. If you are only doing one side at a time, pause the video while you press the other side now. The last point in the acupressure routine is called Yin Tong. And this is found in the middle of the forehead, in between the eyebrows. Try pressing this point using your thumb or index finger. Once again, you can try to press or hold to apply a steady pressure. You can try rubbing in small circles as well. You can also try stroking in an upwards or downwards fashion. Use whichever pressure feels the best and brings about a calming sensation. You may also want to try gently closing your eyes while you massage this acupressure point for 30 seconds.
This acupressure routine may be done many times a day to help you with a good night's sleep. You can try incorporating this acupressure routine into a bedtime ritual. Please continue to pay attention to your body and do only what feels right. If you find certain points to be helpful, focus on those points. If you find other points to be uncomfortable or hard to reach, skip those points. If you have discomfort with acupressure, stop performing the routine. If you have any new or unusual symptoms, or if your symptoms worsen, seek medical attention. Look for other videos in our acupressure series for other conditions. To download a handout with pictures of the acupressure points to use as a reference, please follow the link below.